Welcome to The Data Pulse, a data-driven health podcast breaking down key health trends and insights in South Carolina. Brought to you by the South Carolina Department of Public Health. Visit dph.sc.gov/SC Tracks. Better info, better health. Here's your host, Tony G.
Welcome to this edition of the Data Pulse. I am your partner in praise, Tony G. Today we're talking SC Tracking, a data website which provides a network of health and environmental data to help track and study potential relationships between South Carolina's environment and health. Joining us today, Katie O'Shields Free and Keya Jackson. We're going to meet Keya. She handles some of that data. We'll talk about that after this.
Are you looking for accurate data for school projects, grant applications, or business presentations? SC Tracking has that. Go to dph.sc.gov/SC Tracks. SC Tracking tracks state and county level data. It's easy to get started. Visit dph.sc.gov/SC Tracks. Better info, better health. Brought to you by the South Carolina Department of Public Health.
Welcome back to the program. Today we have a conversation with Katie O'Shields Free, and we get to meet Keya Jackson. She handles some of that data. We're going to talk about that. Ladies, how you doing this afternoon?
Good afternoon. Hi, Tony.
Keya, it's our first time meeting you, so why don't you tell us about yourself and your position at SCDPH?
Sure. Hi, my name is Keya Jackson, and as you mentioned, I'm a data manager for the South Carolina Tracking Program at DPH. And so I'm essentially collecting data that we need to ensure that we stay in good standing with our funding agency, the CDC National Tracking Program. And so they give us about 198 different data measures that they suggest that we have to reach. And that spans 13 different areas, which varies from environmental, public health, and hazard data. And so I'm ensuring that we're collecting that data, all coming from different places. We actually work with 13 different partners to get that data, some of which I request directly or I download from their websites. And so a lot of it does involve fostering and maintaining good relationships with our data partners. I have to communicate what our data needs are, follow up on requests, organize the data, and make sure it's prepped for our epidemiologists who are creating dashboards and also infographics for getting the information out there about the data.
So share a little bit about your background and how you got into this.
Funny story. I actually have a background in marine science. I have a master's in marine science. And so I have essentially focused on my data management skills in order to start working at a public health agency. Something totally different for me, but it's still, the work is still applicable to what I do now in my current role. And I just think it's really interesting, just exploring a whole different field.
You know, you remind me of a conversation I had with one of my uncles in New Jersey, and I'm talking 12, 15 years ago, and he was working for AT&T at the time, and he told me then, he said, Tony, data collection is going to be the next big thing, and here you are right in the middle of doing that big thing.
Like I said, when it comes to working with data, once you essentially learn it, like learn the methods, especially like in grad school or such, those skills can be applied to other areas and other fields and such. So it does very much involve like organization and then also paying attention to details, focusing on having a good understanding of the data.
Katie, the last time we were together, we got into the website, how it works, why it would be of interest to the average person in South Carolina. So before we get into any other information, and that average person does look at that site for information, where would you point them to actually start?
So I would always point somebody to start at a topic that interests them or that they want to learn more about. So the great thing about our website is it does have so many different topics. So it is going to relate or intrigue everybody. So if someone has an interest in maternal and child health, that might be the place I would recommend them to start. Or if they work in an area looking at air quality, I would point them to the air quality dashboard and the air quality infographics, because that is what they can relate to more. We want people to begin exploring the data based on their hobbies and interests. And as they get, in the nitty gritty of all of these details and all of this data, we hope that they'll explore other topics that they might not know more about, and then bring that to their communities, to their churches, to their work, so they can share this information and have conversations about data and these topics.
Katie O'Shields Free and Keya Jackson joining us for this edition of the Data Pulse. We'll come back and talk about indicators. What are they all about, and why do you have to choose the ones that you do? We'll talk about that after this.
It seems like data is everywhere these days, but is it reliable? Data from SC Tracking is both accurate and reliable. It's easy to find, easy to use, and has a guide to help you find the information you need. Visit dph.sc.gov/SC Tracks. Do you want to compare health conditions in your county to the rest of your state? SC Tracking tracks that. Maybe you're concerned about air quality where you live. SC Tracking tracks that. Or maybe you're interested in rates of different types of cancer in your county. SC Tracking tracks that too. Visit the SC Tracking website at dph.sc.gov/SC Tracks and try it out. Better info, better health. Brought to you by the South Carolina Department of Public Health.
We're talking the SC Tracking website. You can find it at dph.sc.gov/SC Tracking. Talking now with Katie O'Shields Free. Indicators are on this website. What are those indicators? How do you choose them, and why do you choose them?
These indicators were chosen. Some of it like I mentioned before, this is a grant or cooperative agreement that we received from the CDC. So some of the data we have to, per our grant agreement, to display on the website. So variables like air quality, water quality, those are dedicated CDC environmental public health tracking indicators that each state who's funded has to show. But there's other indicators that we as a state like to show because it could be of an interest in certain populations. We could see higher or lower rates in our communities and in our counties. So we want to highlight that and bring attention and awareness to that. So for example, we have a life expectancy dashboard on our website where people can see, based on where they live, what's an average length of life they're expected to live. Mm-hmm. That's not a data point that we are required to show by CDC, but it's one that we think is so important that we wanted to show it anyway. So we do have some kind of requirements by our funding agency, but we really like to get out there and put as much data really impacting the needs of our community and really meeting them where they are.
So Keya, I understand that states have their own autonomy to select indicators that are leading priorities in their particular states. Let's talk about that a little bit.
Yes, definitely. As Katie mentioned, we can incorporate different data that is relevant to our state, which is, again, encouraged by the CDC because, of course, we know what's happening in our state. We live here. We want to make sure that the information is relevant. So, there's some data that is relevant to all states, like drinking water. Like, everybody's monitoring drinking water. Everybody's monitoring heart attacks and stroke. But, like in California, they have issues with, wildfires out there, and that's impacting the air quality versus over here, we more so have issues with hurricanes. So we want to make sure that we are pulling in data that is most relevant to our state. So that way we can help to address these different environmental, public health, and hazard issues that are going on here.
Gotcha. Katie, I understand you presented at the NLIEF Multi-State Quarterly Meeting. You're going to have to tell us what that means. So tell us about the presentation and where people can go to get more information on it.
Yes. So, we work in the government and we love our acronyms. So NLIEF is the National Lead Information Exchange Forum. And it is commonly, because that's a mouthful, it's commonly known as NLIEF. And so we were approached. This is a national group that looks at and monitors lead information across the nation. So this was a national organization that invited us to present because they were trying to do a presentation on displaying childhood-led data, and they came across our environmental public health tracking or our tracking website and reached out to our childhood-led partners here at the agency of DPH, and they wanted someone to present about how we went about putting all of this information out into a platform that made it easy to understand and use. So when we were approached to present, we thought it would be a great opportunity to highlight our relationship with our childhood-led program, because the work that we do really is dependent on the programs that we work with. So we have a great relationship with our childhood-led team, and they do all of the hard work of collecting the data, making sure that data is getting reported into the systems. They share it with Keya, and then our epidemiologists really visualize that data to make the data look meaningful, to make it easy to understand and interpret. So that meeting really gave us a great opportunity to showcase the information that we have at the state for other states to hopefully copy and take tools and tidbits from to implement that at their own state, because we do know that childhood-led is an important topic. We see people still being testing positive for childhood-led poisoning. We want to reduce those risks, bring awareness to the various types of exposures, what causes lead poisoning. And so that really gave us a good national platform to present that information. We will be sharing the information of the presentation, copy of the presentation on our SC tracking website. So individuals who weren't able to attend the lead information exchange forum will still be able to get that information. We want people to use our tools as resources as much as they can. We don't want to hide anything. We really want to be a resource for the public.
So are there different populations that would benefit from that information?
Yes. So in regards to childhood lead poisoning, anyone who has young children, it's a great opportunity to see, where are those exposures, or where are the potential exposures of childhood lead coming from. Lead isn't an element that we want our children to be exposed to, but if you don't know where they could be getting exposed to, that's putting them at risk. So getting that information of where my child could get exposed to childhood lead, what if I think my child's been exposed to lead, where could I get them tested? You can see across the state, are there certain areas that are more prevalent to seeing this childhood lead poisoning than others? So it really is a great place to get knowledge on the childhood lead poisoning topic and just learn more about it. And then you can share it with others in the community as well.
So that one was about lead. Is there a possibility of having a presentation done on another subject?
Yes, we absolutely love going out into the communities or to other organizations, to schools, churches, work environments, to present information on various environmental and health topics. So our program, like we've mentioned, has a variety of data. So we are able to go into those communities on topics or a specific topic of interest for that group. So if anyone is interested, we would love to talk with you to set up a time to present to you, to your work group, to your coalition or organization. And if you do have some interest in having some of us present, please reach out to us. We have an email that we all have access to that we would love to set something up. And that email is sctracking@dph.sc.gov. So we would love to talk with you all, set up some chances for us to come and work with you to really bring this data into the communities.
Katie O'Shields Free and Keya Jackson joining us on today. Katie, tell everyone how they can find the website once again.
So for anyone who would like to understand or see more information on our website, please visit us at www.dph.sc.gov/tracking.
Thank you, ladies, for joining us today.
Thank you so much.
Thank you.
That wraps up this edition of Data Pulse. I'm your partner in praise, Tony G. Don't forget once again to check out the website, dph.sc.gov/SC tracking. That's dph.sc.gov/SC tracking. We'll see you again next week for another edition of the Data Pulse.